Hello, my name's Jonathan Gribbin, and I'm the Director of Public Health for Nottinghamshire, and I lead the county's response to COVID-19. None of us want our children to miss out on all of the benefits that school brings. So I want to let you know just how hard our schools have been working to ensure that they've all got in place the sensible precautions to receive back pupils at the start of the new year. But of course, all of us need to play our part in stopping the spread. So alongside the guidance you know about already, I also want to urge you to follow the guidance on safe travel to school. Please walk or cycle, or if a car journey really is essential because you live more than 2 miles from school, please arrange drop-offs well away from the school itself. You can find out more details about this and about all of the other government guidance on our website. If you've any questions about plans or arrangements at a particular school, then the school itself will be the best place to answer them. Thank you for watching.
My name's Jonathan Gribbin. I'm the Director of Public Health for Nottinghamshire County, and I'd like to tell you about the COVID-19 Local Outbreak Control Plan for Nottinghamshire. It's all about containing the virus so that we can protect one another, safeguard our critical services, and enable our schools, our workplaces, our communities to flourish again. And the plan describes how we will do that in Nottinghamshire. It complements the national test and trace arrangements, and it builds on local arrangements with key partners like Public Health England, the district and borough councils, the city council and our local NHS. It identifies a range of settings such as schools, workplaces, universities, care homes and so on, which require specific plans to deal with any fresh outbreaks of the virus. It describes how we'll be monitoring on a daily basis to spot if there are any new outbreaks, and then coordinating action to investigate and deal with them, deploying extra testing capacity if we need to, or contact tracing as appropriate. The plan also deals with how we will continue to provide support for people who are made vulnerable because they need to self-isolate, and we'll be doing that through our community support hub. And we'll refine the plan as we go along to reflect the latest best practice and the information which government will be providing to the council. Finally, I want to acknowledge the lengths to which so many people and organisations have gone to already in recent months to stick with the guidance, to maintain social distancing of 2 metres wherever possible, to wash your hands thoroughly and frequently, to stay at home if you or someone in your household has symptoms, to get tested and to follow the advice that you receive when you get the result. By observing the guidance, you're protecting not only your own life and livelihood, that of your friends and also your loved ones, but also that of people you may never meet, but people who you're depending on and whom we must each depend as well. Your role in that is critical. Thank you for your help to contain the virus.
The 3 words I'd use to describe my role is team, rewarding and challenging.
Positive, team, supportive.
3 words I'd use to describe this job: gratifying, inspirational, challenging. Before this I was a hairdresser, but I wanted to do more than make people feel good. I wanted to help change their lives. I'm now part of a team that does exactly that every day.
I spend my days talking to the residents of Nottinghamshire, their families and the support services that help them on a day-to-day basis. We're the front door to adult social care in Nottinghamshire, and we're responsible for taking the time to build a picture through to
The three words I'd use to describe my role is team, rewarding and challenging.
positive, team, supportive.
3 words I'd use to describe this job: gratifying, inspirational, challenging. Before this, I was a hairdresser, but I wanted to do more than make people feel good. I wanted to help change their lives. I'm now part of a team that does exactly that every day.
I spend my days talking to the residents of Nottinghamshire, their families and the support services that help them on a day-to-day basis. We're the front door to adult social care in Nottinghamshire, and we're responsible for taking the time
Tony Harper, and I'm chairman of this committee. As well as myself, the other members and officers present in the meeting today. Noel, please.
Chair, if we could just pause for one moment. Just bear with me one moment, please. I'm sorry, I just need to talk to a technical colleague. 1 second, please. Thanks again, as always, for your patience.
Are we ready now then?
Yes, good morning, everyone. The other committee members who are all present are Joyce Bosniak, Dr. John Doddy, Boyd Elliott, Sybil Fielding, David Martin, Francis Purdue-Horan, Andy Sissons, Steve Vickers, Muriel Weiss, and Yvonne Woodhead. And in addition, we have the following officers present today. Mel Brooks, Corporate Director, Adult Social Care and Health. Jonathan Gribben, Director of Health. Sue Batty, Service Director, Community Services, Aging Well. That's her title. Ainsley MacDonald, Service Director, Community Services, Living Well. Grace Natoli, Director of Transformation. Jenny Kennington, Senior Executive Officer, and Kath Sargent, Senior Finance Business Partner, and myself, Noel McMenamin. Thank you.
Thank you, Noel. We'll now move to item 1 on the agenda, which is the minutes of the last meeting, which was the 13th of July. Seems a long while ago. Everybody's had it as a pre-read. Can the minutes be agreed, please? Anyone against?
Agreed.
Agreed. Thank you very much. That's been carried. Now move on to item 2, apologies for absence. Mr. McMenamin, please.
None received. We're all present and fully coherent. Thank you.
Thank you, Noel. Item 3 on the agenda is declarations of interest. Do any members or officers present have any disclosable pecuniary interest to declare? And do any members or officers present have any private interest, pecuniary or non-pecuniary, to declare? As I always say at this point on the agenda, if you start working our way through the agenda and something suddenly crops up, then please just shout up, that's fine, and just declare it then. But has anybody got anything to declare at this moment? Thank you. We'll now move on to item 4 on the agenda, which is on pages 9 to 16 in your agenda pack. And it's the implementation of the Health Protection Coronavirus Restrictions Regulations 2020. Nottinghamshire County Council has been given powers under the Health Protection Regulations 2020 to give a direction which imposes prohibitions, requirements or restrictions in relation to individual premises, events and public outdoor places. The report explains the regulations and how they should be used. Since their enactment, these powers have been available for exercise by the Chief Executive in accordance with the Council's urgency procedures, with any exercise of such powers to be reported to this committee, Adult Social Care and Public Health, and as necessary to the Policy Committee. And I can say that to date the powers have not been exercised. The proposal now is to formally delegate authority to exercise these powers to the Chief Executive. In order to progress the preparations for the above, a task and finish group comprising the Director of Public Health, Chief Executive, Monitoring Officer and group managers responsible for legal service and trading standards has been established. Arrangements have also been considered by the Chief Executives of Nottinghamshire County Council and the District Borough Councils. Work developing the necessary operational arrangements after a direction has been made is being led by the trading standards in liaison with the District and Borough Council's environmental health colleagues. The financial implications are contained in paragraph 42 to 45 of the report, and these figures are subject to approval by this committee under a separate agenda item, the report on the Local Authority Test and Trace Resource Plan. So the recommendations of the report are set out on page 15 of your agenda pack, that the Adult Social Care and Public Health Committee formally delegates authority for the exercise of all powers under the Health Protection Corona Restrictions England No. 3 Regulations 2020 to the Chief Executive. Such powers to be exercised following consultation with the Director of Public Health and, where possible, having sought the views of the Leader of the Council, the Chairman and Vice Chairman of Adult Social Care and Public Health Committee, and the leaders of the opposition groups of the Council. So, for the avoidance of doubt, Committee also approves that this delegation of authority may be exercised by the Deputy Chief Executive or the Corporate Director for Adult Social Care and Health in the absence of the Chief Executive. In addition to the delegation to the Chief Executive above, to authorise the Service Director for Place and the Group Manager for Trading Standards and Communities to designate officers within Nottinghamshire County Council or other partner agencies to exercise powers under the regulations with regard to notification, management and enforcement of the requirements, including but not limited to the issue of prohibition notices and fixed penalty notices. Such designation to include authority for designated officers to designate additional officers within their partner agencies as they seem appropriate in order to effectively manage the control of outbreaks and the enforcement of any directions. So it seems very wordy and perhaps difficult to understand, but all of it has to go into the recommendations because that's what we're actually discussing. So I formally move the recommendations. Do I have a seconder, please?
Happy to second that, Chair. More than happy.
Thank you. That's Councillor Boyd Elliott. Director of Public Health, Jonathan Gribbin, would you please introduce the report?
Good morning, councillors. I think, Chair, your introduction was very full, so I've not got anything to add to the introduction that you've given already, but of course ready to help with any questions.
Thank you, Jonathan. Do any members have any comments or questions, please? I've got Councillor Muriel Wise, please. You're muted, Muriel.
Thank you, Jonathan. I think it's really good, and I'm sure we all appreciate the meticulous way in which this paper's been prepared. I think it's really important that it is meticulous in terms of what decision making is being sought. I think when decisions are being made about any limitation on people's liberty and the choices they have, I think it's really important that the government is as simple and straightforward and clear, not simple, but clear about what those areas of limitation are. And I think the government is struggling with that to some extent in a complicated situation. I suppose locally you only have limited control of national messages, but this report really reassures me that if a situation does arise, you're going to be as specific as possible about what the decision making will be and what its effect will be and what the timescale for the application of that decision will be and when it will end. So thank you very much for the report.
Thank you, Muriel. Jonathan, do you wish to comment on that?
No, thank you. Other than that, I'll pass on your acknowledgement and comments to Heather Dickinson, our Group Manager of Legal, who's drafted substantial parts of this. So thank you.
Thank you. And Muriel, yes, we do try to give as much as we can within the bounds of what we're allowed to do. We do try to give us fuller explanation. And I know Jonathan has done a great deal of press releases and press appearances, media appearances. So we have got our finger on that one. So thank you for that. Any more comments or questions, please? I've got nobody showing on my screen. No, thank you. We'll now move to the vote. Again, as is usual practice with these video conferences, anyone against the motion? Anyone abstaining? I'll therefore assume assent and the motion is passed. Thank you. So we'll now move on to item 5 on the agenda, which is on pages 17 to 28 in your agenda pack, and it's the Local Authority Test and Trace Grant Resource Plan. Upper tier local authorities are responsible for leading local outbreak control plans to contain local outbreaks of COVID-19. The objective of this is to keep people safe, safeguard critical services, and enable our communities, schools and economy to flourish. In support of this, the government has released a local authority test and trace grant for which Nottinghamshire County Council has been allocated £3.8 million. The grant is ring-fenced for expenditure in relation to the mitigation and management of local outbreaks of COVID-19. Use of the grant funding therefore represents no additional burden to the authority's medium-term financial strategy, MTFS. The proposed resource plan for use of the grant in Nottinghamshire is contained in Appendix 1. It is based on an understanding of the capacity needed to sustain routine local outbreak control functions as they are currently understood. The staffing element will ensure that sufficient capacity with the appropriate skills and experience is in place to maintain routine local outbreak control functions. The non-staffing element is designed to deliver core aspects of the local outbreak control plan, and these include an enhanced infection prevention and control offer, communication and engagement activity, additional testing capacity, and support to vulnerable people and complex contact tracing. The recommendations of the report are set out on page 20 of your pack. They are to approve the use of local authority test and trace grant as per the proposed resource plan, for which Nottinghamshire County Council has been allocated £3.8 million by the government. To approve the establishment of fixed-term staffing posts to support the Public Health Division as set out in Appendix 1, funded by the local authority test and trace grant. And finally, to approve the use of media communications in relation to the fulfilment of local outbreak control plan responsibilities. I formally move the recommendations. Do I have a seconder, please?
Happy to second that, Chair. Thank you.
That's Councillor Boyd Elliott. Director of Public Health, Jonathan Gribbin, would you please introduce the report?
Thank you, Chair. So the things I just want to add by way of introduction to what the Chair has covered already is that in Appendix 1, which itself is really in 2 sections, you'll find in the opening section setting out there a dozen or so of the fixed term posts which we wish to create and will be hosted within the local authority. But in addition to that, sitting alongside it, listed under non-staffing costs, there are another 8 or 9 lines listed there, which for the most part will represent resources which will be hosted in other parts of the local system. So to give you a couple of specific examples, lines 13 and 14 relate to infection prevention and control. And although there's some further work for us to complete with our clinical commissioning group colleagues, what we're envisaging is that that resource would be hosted within our local NHS, within the clinical commissioning group. So it will form part of the overall resource which is available to the outbreak cell, but it'll be resource that's hosted in other parts of the organisation. And then the other thing I wanted just to give fresh emphasis to is the extent to which we're approaching all of this on an LRF footprint, a local resilience forum footprint. In other words, we're doing this in a way that is very joined up with our colleagues in Nottingham City. And the reason for that is that principally is that it provides much greater resilience for our residents in the county. And similarly, I dare say the same is true for residents in the city. And of course, coronavirus itself doesn't particularly pay much attention to some of these administrative boundaries. So the resources which I'm setting out here will be largely deployed alongside similar resources which my colleagues in the city are securing approval for as we speak. We've got some recruitment underway for these resources already, and I'm hopeful that during September and into early October we'll be in a position to shortlist and to interview for some of those. I've taken the liberty of, with the Chair's permission, I should say, pressed ahead with a couple of recruitments and secondments in particular. So I should let you know that the first line in Appendix 1, labelled up number 1, is for consultant in public health or equivalent. And I'm really pleased to say that over the last couple of weeks or so, Cathy Quinn, who some of you will know, used to work in the public health team and has latterly been working for the CCG, has agreed to come back to us on secondment for up to a year. In addition to that, against item number 11, the environmental health officer, I'm really pleased that Sheridan Stock, an experienced environmental health colleague from Newark and Sherwood District Council, has also been appointed to work with us on secondment. That's as much as I think I need to say by way of introduction, Chair.
Thank you, Jonathan. I've got one speaker at the moment. That's Councillor Bosniak. Joyce, please.
Thanks, Chair. Just 2 questions on this one, I think. One, it seems to be £3 million seems to be a substantial amount of money. However, when you start to unpick it, maybe it's not as much as it's not sufficient. We could always do with more. And I'm really pleased to see that Cathy is coming back to join us again. She knows Nottinghamshire, she knows all the partners in Nottinghamshire, should be a real asset. And I just wanted to know, although Tony, in your introduction, you started to give some detail about the particular posts, and I wonder whether Jonathan wanted to elaborate further about why these particular posts were necessary. And then certainly still on that same paper, I wanted to know about the sum of money that will be going to the districts and how that will be allocated, whether it will be divvied up or whether it'll be to do with the amount of work that they'll receive that money for. So that's two main questions. But then I suppose my other concern is, well, one, I'm really pleased you're getting somebody to beef up the communications as well, because I think no matter how hard we've tried, communication is probably the single most vital thing that we need to address. And given the confused message sometimes coming from central government, it's even more important that we get it right. And my question would be around communication is, I understand that Marion Clay is doing some work within schools, so the message coming back from schools is getting clearer, more joined up, and more relevant. I wonder whether information that's going to the parents, for example, if a parent has a child who's got a cold, does he or she send that child to school and then expect that child to be sent back home again? And I've heard at least 3 people now have said that is their main concern is, do I send my child to school only for that child to be sent back, or do I keep them at home and risk being told off, so to speak, for not sending the child in the first place? So I think we need some clarity about messages. So it seems as though we're getting around to schools, and I'm really pleased about that. But what's the message going out to parents? How do we help support them make those kind of decisions? So there's a few for you to have a go at. Thank you, Chair.
Thank you, Joyce. Some good questions there. Jonathan, please.
Thank you, Councillor Bosniak. So let me start with the sum of the grant and the uncertainty around that. You're right to note that it's a large sum of money, but it's not altogether clear for how long this might need to last, or indeed whether over the course of time there may be additional responsibilities which local authorities are asked to take on, which up until now have been managed centrally. So an example of that would be the contact tracing, which up until now has been undertaken within the nationally commissioned NHS test and trace system, but which we know through through national media and through our own discussions, that a number of local authorities have taken on some elements of this and are able to do it more effectively than the nationally commissioned arrangement. So that is something that we're pursuing. But of course, as we understand more of that, we will become better placed to be able to quantify exactly how much resource it requires and how much of this 3 million will need to be set aside for it. And I think you put your finger on some of the uncertainty that exists within what I've set out in Appendix 1 in the second half of it, lines 13 to 20. Some of these look like very round numbers, don't they? And those round numbers are indicating that actually there is some uncertainty about exactly how much we will need to assign to each of these lines. You asked about how I think about how what some of these different roles will be doing and how we'd identified some of these. So I think our starting point has been to take a look at what is it that public health and other colleagues are currently doing in the work of the daily outbreak cell and in the incident management teams that the daily outbreak cell stands up. And we've got quite a lot of my own team from City Public Health, colleagues from comms, from environmental health out in the districts and counties, a number of colleagues pulled in from other teams across the local authority to support that existing work. So in part, what is listed here simply represents what is currently going on and making sure that we pull in the right kind of resource with the right sorts of skills to be able to sustain this over the next 12 months. Because as you'll appreciate, a lot of this has been run up until now in a way which relies very much on people's willingness, their capacity to work a lot of extra weekends and evenings and some very long hours without much in the way of downtime. And for the sake of our residents, as well as those members of staff, we need to make this sustainable going forward. There are some other things that we've taken into account in trying to work out how much resource we need. For example, the government recently published to local resilience forums a reasonable worst case scenario for what the next 9 months or so might hold. This is not a prediction at all. It is just what it says on the tin, a reasonable worst case scenario. But we've also referred to that in trying to work out what it would be reasonable to ask for and secure in terms of resource. if next winter turns out to be very bad, we may find that this is not sufficient resource. If it turns out to be much milder, much easier in COVID terms than we're preparing for, then we know already that there are a number of other things to which we could deploy these staff. So I have no concerns about ending up with people sitting around twiddling their thumbs. You asked about the allocation of the monies to districts and boroughs. And I think probably my initial comment in regard to that would be a repeat of what I said before, which is that we're still working through with the districts and boroughs exactly what additional costs will fall to them. The contact tracing that we're likely to take on board within Nottinghamshire County, I think will benefit enormously, indeed is likely to rely considerably on the sort of expertise and resource that resides in our environmental health teams in our districts and boroughs. So that's likely to be one call on this on the grant. Another one will be if we find ourselves exercising the number 3 regulations that we dealt with a few minutes ago in the earlier agenda item. In all likelihood, we are likely to have to work very closely again with our district and borough colleagues to implement and enforce those. So depending how much of that we need to do and how often, it may be that districts and boroughs will have a very considerable claim on some of this 3 million. The numbers that I've put in here are our best estimates for the time being. We've consulted closely with our chief execs in the districts and boroughs, and for the time being, they're very content to approach this on the basis that they will make claims on a kind of a pay-as-you-go basis. But that in the first instance, they will be looking to divert and redeploy their own resource internally, and then secondly, to look for existing mutual aid arrangements between districts and boroughs, and then after that to come to the county council. And then finally, you made some comments about schools, and I can confirm, as you indicated, that Marion Clay and her team have put a lot of time and effort over several months now, working with head teachers and schools and helping them to ensure that all the right arrangements are in place to receive back pupils at the start of this school term. And yes, we're also working with Marion and with colleagues in Public Health England to make sure that the messaging to parents as well as to to school leaders is clear and consistent. There is government guidance about what parents should do in regards to sick and ill children, and we will take the opportunity, Councillor, to re-amplify and send that out again and make sure that the comms around that from our side is spot on. Thank you.
Thank you, Jonathan. Joyce, is that okay?
Yeah, very happy with that. Very full, detailed response from Jonathan. And I suppose I'd also like to, on behalf of everyone, thank all of the team, both in adult social care and public health, because we do know that they're virtually on their knees anyway. So we're really grateful for that. I just needed to know exactly that we were thinking about not just the present, but also the future. So thank you for that.
Thank you, Joyce. Right, I've got Councillor Sissons followed by Councillor Doddy. So Councillor Andy Sissons, please.
Yes, thank you, Chairman. So something similar to what Joyce has already said in a way, but I may have missed something in the papers. I'm sure Jonathan can put me straight. This 3.8 million, which seems like a lot of money until you start breaking it down, and I know it's ring-fenced purely for the pandemic spending. Is any of this to replace any monies already spent, or is this purely for future spending from now forwards? And another question about the schools. I've had residents ring me in the last couple of days, and one had sort of a specific question. He asked me, because his son is a single parent, sadly the child's mother passed away, so the young man is reliant on his work, and his child was sent home because he'd got cold symptoms, which it's difficult to say, but we would associate with a cold, a runny nose, etc. And the young man asked me to put the question, what specific guidance had been given to schools from central government as regards which children to keep in school and which to send home. Another resident told me that her child had simply cleared her throat in class, and perhaps I know it's very difficult. You've got to work on the err on the side of caution, but simply clearing the throat, and she was sent home from school. Not a persistent cough, but just a side movement. I wondered what specific advice was given, and the young man asked me, is this advice on a website so that he could have a look at it for himself? Thank you, Jonathan.
Thank you, Andy. Jonathan, please.
Thank you. So to your first question, Councillor Sissons, the grant that we're dealing with here, the 3.8 million, is not, we're not looking to use this to cover costs already incurred. For example, some of the costs associated with PPE, for example, back in the springtime. This is more to make sure that our arrangements going forward for the next 12 months or so are sufficiently resilient. And to your second question, it's difficult to comment in detail on this specific case, but in terms of the more general question I think you're asking, yes, there is, as I mentioned to Councillor Bosniak, there is guidance on .gov.uk website. And I think perhaps what I could do with the help of my colleague Louise Lester, who's on this call, is after this meeting would be to circulate to committee members the guidance that goes out to schools about how to deal with children who are not well at this point. The thing I would add to this at this point is that the other bit of guidance that we're giving to schools, which we underline very clearly and repeatedly to them, is that in terms of managing COVID-19 cases and indeed confirmed cases, that the channel, the line of communication is from them to our local health protection team at Public Health England. And Public Health England have the right people in place and a telephone line being manned to help the school do a risk assessment to determine what is the right action to take in regards to confirmed cases of coronavirus. But of course, this is really important as well. We want as many schools as possible, and as far as it is safe to do so, to stay open. So we're emphasising that line of communication to all of our schools and repeatedly putting that out in our communications as well.
Thank you, Jonathan. And is that okay?
Yes, I was just going to say that's been very helpful. Thank you, Chairman. Thank you, Jonathan.
Thank you. I now have Councillor Doddy. John, please.
Yes, am I off mute?
Yeah, you can hear you loud and clear.
Very good. It's fantastic to see investment in public health, which prior to COVID had the potential to drift into some form of Cinderella service that was seen to be there, but nobody took any great interest in it. It's taken a bit of a pandemic to shake people up and say, hang on a minute, there's something that we're missing in the care of the population, and that being public health. The big move recently has been sort of the creation of the National Institute of Health Protection. And one of the main things that seems to have occurred is a move to infectious diseases and the detection and prioritisation of the protection of the public. And that's where this money comes in with the track and trace. Let's have 2 consultants and they'll help us track and trace and improve the detection rate of COVID in the community and improve the health and well-being of those people. However, one of the big casualties of COVID has been the lockdown problems of weight gain, increased drinking, increased mental health problems, lack of mobility, and a huge increase in the existing health inequalities that exist within the less well-off and the most challenged individuals within society. And strange as we like to find out to people who've got COVID, there is nothing in this to help look at the vulnerable groups which are most vulnerable to the disease. So there's no point in tracking it down if you don't look to see who's actually vulnerable and try to improve their inequalities. If we're not coexistingly improving obesity, coexistingly tackling the problems that exist out there through people in poverty and overcrowding, etc., then again, you're looking at only one aspect of the whole challenge, which is the track and trace. I would have loved to have seen part of this 3.8 million dedicated to somebody to restart and dedicate time to improving the resilience of the population against the disease. And I think all in all, throughout the whole of this period of time, we're sort of like King Canute, trying to hold back a tide or put our finger in a hole in the dike. But the real challenge going forward is to improve and increase the resilience of the community. Is there any possibility that one of these two consultants might be able to remove their focus from the simplicity of track and trace and look at the complexity of the needs of the population, and particularly those who are most vulnerable, which are those with the most health inequalities? Jonathan.
Thank you, John. Jonathan, please.
So let me answer your question very specifically, and then make a more general point, if I may. I think we can do better than that, even Councillor Doddy. What having these consultants in place and these other staff would enable us to do would be to free up some of my existing staff and team who've been pulled off some of the kinds of work that you've been identifying in order to address the short-term and urgent threats of coronavirus. So getting some of these resources in place will enable us to resume some of the attention that should properly be given to some of the inequalities that you're identifying. To make a more general comment about those, I agree with you entirely. The early analysis that's been done at a national level shows that that mortality for people in our least advantaged communities is COVID-related mortality, I should say, is twice that of people in our most advantaged communities. That's not a surprise to anyone on this committee, but it's nevertheless something that's very serious and is enduring. And I think it reflects existing long-standing inequalities. And as we know, most of those inequalities are driven by factors that relate to socio-economic conditions, our place and environment. So I'm very keen that the government, in revamping its structures and coming up with this National Institute of Health Protection, doesn't end up with a fresh set of structures which fragments attention to health protection from other health improvement kind of agendas. I think they all need to be looked at as one and holistically, and approached giving reference to place and environment and the importance of those in shaping the health of a population overall.
Thank you, Jonathan. You did break up very slightly at the beginning. Councillor John Doddy, did you get all of the answer okay?
I did. It's akin to a patient who bangs his head off the wall and then comes to me for something for the headache. I can give him 2 paracetamol for the headache, but eventually he's going to have to stop banging his head off the wall. And I think it's going to come down to that with public health management of COVID, and back to the very basics of the health of the nation. Thanks, Jonathan.
Thanks, John. I've got Councillor Wise as the last speaker. Muriel, please. You're muted, Muriel. We'll do it.
My hand doesn't move quickly enough, I'm afraid. It's a question about testing in care homes, Jonathan. I know that Melanie and her team have got a very excellent programme of support to managers for the whole COVID issue, but there is quite a kind of, so perhaps more nationally than locally, there's a concern about, you know, the issues about whether families can visit, how often testing should take place, whether it's a lack of resources or whether it's a lack of testing stations, or whether it's lack of clarity about when testing should take place. I just wondered if both in the resourcing of your team and generally you think that public health is giving enough support and guidance to the care sector in terms of how to manage testing in care homes. So it's partly a national question, and I know you both are working as effectively as you can in Nottinghamshire, but there does seem still to be a level of concern about what managers should be asking for in terms of testing.
Thank you, Mira. Jonathan, please.
Chair, perhaps I could start off with a reply, and with your agreement, it may be that that Melanie has some further comments she wants to make about care home visitation and so on more specifically. So I think the testing that is undertaken in our care homes is really important, and it's undertaken to a pretty clear protocol. And in Nottinghamshire, we're very fortunate that right from the get-go back in springtime, our NHS colleagues helped establish a Nottinghamshire-wide test coordination team to make sure that things were working really well across the whole of our system. And you'll see on it was on line 16 of Appendix 1 that we've set aside some monies there to make sure that we're able to sustain that really well for right the way through the winter and into next spring. So there's line 16 was around testing, coordination, deployment and outreach. So I absolutely agree. It's really important that we sustain this effort and that there's clarity, and of course that there's sufficient capacity within the testing system to undertake the tests and get really timely results. I'm not sure I can answer more specifically than that, Muriel.
Okay.
Thank you, Jonathan. Yeah, the Corporate Director of Adult Social Care and Health would like to give an input on this one. Melanie, please.
Yeah, just to note that bit about resources. So I am quite comfortable that the joint resources we have across the infection control team, public health, adult social care and the care sector is sufficient at the moment to manage the current demands. But I think as Jonathan's been really careful to point out, that's managing the current demands of the current situation. I think if we were to start to see some of the pressures emerging around winter, that might be a concern. But I think at the moment, Muriel, we're quite content with the way we're working, and we have got the ability to stand up and down the incident management team that works around care homes. And so, for example, you may have seen the Times newspaper over the weekend, which mentioned a report which we haven't had sight of, unfortunately, from the Department of Health, that Nottinghamshire had seen cases spiralling out of control. So we haven't seen that in our local data, but we have seen an increase in care home situations. So this morning we're standing up that team to address that and to see what else we need to do around care home support. So we have got that ability to flex that input. I think in terms of the complexities about visiting, so you'll be aware, Muriel, that care homes as well as ourselves are governed by human rights legislation, which gives people the right to family life. So we're well aware that we need to facilitate, where possible, safe visiting for residents to keep in touch with their loved ones, as well as professionals who are undertaking specific lawful duties. And we need to balance that with the risks of COVID, both to them, the community and other residents. So it is a balancing act. So in order to do that, we've maintained our regular communication with providers, and Jonathan and I discuss, as we did yesterday, if we need to amend any guidance to care homes as a result of the emerging situation. So Gemma will be talking later on in the meeting about care home support, but we regularly share the local outbreak plans with care home providers. We'll alert them to any concerns we have about the rise of cases, but ultimately the role about assessing whether that is safe has to sit with a care home. Only that care home can assess whether it's safe to enable a visitor, whether they can do that safely in their care home, because care homes are so different. But it is something we're very mindful of and that we give a lot of attention to at the moment, because it's vitally important.
Thank you very much. That's really helpful. Very reassuring. Thank you.
Thank you, Mel. That was really useful. Thank you. We've got no more speakers, so we'll now move to the vote. Anyone against the motion? Anyone abstaining? I'll therefore assume assent. Thank you. We'll now move on to the next item on the agenda, which is item 6, which is on page 29 to 32 in your agenda pack, and it's Public Health Children's Integrated Commissioning Hub staffing. Public Health have hosted the Children's Integrated Commissioning Hub since 2013. This team ensures a coordinated approach is taken to commissioning public health and community health services in order to meet the needs of Nottinghamshire children and young people. The hub acts as a system leader and a single point of coordination for the commissioning of outcomes for children's health and wellbeing services across Nottinghamshire Clinical Commissioning Groups, CCGs. Nottinghamshire County Council Public Health Division and to a degree Children and Family Services. So the team is part funded by the Nottingham and Nottinghamshire Clinical Commissioning Group and Public Health, and a memorandum of understanding is in place between the County Council and the CCG with agreed priorities. Bassett Law CCG contribute funding to a programme lead post which is hosted within the hub. The hub has a number of key objectives to deliver in the next 12 to 24 months, and to support these it requires sustained capacity within the team. It's therefore requested that a fixed team, currently filled, Public Health Commissioning Manager post is converted to a permanent post within the team, and the Children and Young People's Mental Health and Wellbeing Programme lead post is extended for up to 17 months. The recommendations of the report are set out on page 31 in your agenda pack. They are to approve the establishment of one FTE permanent Public Health Commissioning Manager post, and 2, to approve the extension of one full-time equivalent Children and Young People's Mental Health and Wellbeing Programme lead, fixed-term post for a period of 17 months. I formally move the recommendations. Do I have a seconder, please?
Yeah.
Councillor,
I'm happy to second it.
thank you. That's Councillor Boyd Elliott. Jonathan, would you introduce your report, please?
Chair, if I may, I'll ask Louise Lester, who leads the Children's Integrated Commissioning Hub, for me to pick up any points on this, if I may.
Thank you, Louise.
Hi, good morning. Thank you, Chair. So yes, I think you've summarised really well what we're looking to do. Just to add, the posts are currently both within the establishment, so we're not adding any additional posts. We're just seeking to make one of those posts permanent and one of those posts being extended. As you can see from the paper, we have the finance for both of those secured externally, so it's not coming from the public health grant, it's coming from funding from within the CCG, but really important that we continue to be able to do the work around the long-term plan. Sorry, there's a plane just flying over. To a lot of the things that we've been talking about already for children and young people, particularly talking about schools and the potential mental health issues that we need to make sure we continue to look at for our children. So I'm happy to answer any further questions.
Thank you, Louise. We've got nobody with the hand up. Therefore, we'll now move to the vote. Anyone against the motion, please? Anyone abstaining? I'll therefore assume assent. Thank you. So we'll now move on to item 7 on the agenda, which is on pages 33 to 52 in your agenda pack, and it's Adult Social Care Performance and Financial Position Update for the quarter, which is quarter 4. and Q1 of 2021. So the report brings together the department's current financial position as of the 30th of June 2020, i.e. last June, and a summary of performance for adult social care and health for Q4, which is 1st of January this year to 31st of March this year, and Q1, 1st of April 2020 to the 30th of June again this year, which is detailed in your appendixes A and B. It also provides a year-end validation for the Improving Lives portfolio and an update on the department's savings for 2021. Again, details can be found in paragraphs 11 to 15. The progress to date on the approach to the new performance reporting framework is also included. The 3 stages are summarised in the diagram at paragraph 20. Narrative and examples to explain the department's performance have been captured under the new performance framework headings, i.e. positive contributions, which is paragraphs 30 to 38, independence 39 to 58, quality of life 59 to 68, and use of resources paragraphs 69 to 70. The recommendations of the report are set out on page 44 of your pack, and that is that the committee considers whether there are any further actions it requires in relation to the finance and performance information for the period 1st of January 2020 to the 30th of June 2020. So to debate it, I'll formally move the recommendations. Do I have a seconder, please? That's Councillor Boyd Elliott. Thank you. Corporate Director of Adult Social Care and Health, Melanie Brooks, would you please introduce the report?
So thank you. So committee, I think the first thing that you will note is that the timing of the report is quite crucial. So this report was drafted based on figures for June. So at June, we clearly were in the midst of responding to emergency and in full emergency planning mode. And at that point had also suspended performance management. So what I intend to do for the committee is talk through what the current financial position is. And then if there are specific questions about our performance relating to ageing well, living well, or other areas, we'll answer those questions. But I think the performance report for the next committee in October will be much more meaningful in terms of giving some good data about the performance, because clearly the timing was quite critical when we produced this. But just turning to the financial position, so I think the first thing to give some reassurance around is that our current financial position is much healthier. So at the time of this report, we'd incurred a large degree of cost mainly for supporting the care market to cope. So we were funding PPE, workforce, and a whole range of measures in terms of their contracting to maintain their income. So since this point, we've had the infection control grant, which has been able to offset some of that liability. We've also, as a department, had a number of mitigations in place to manage the money to offset some of that additional COVID costs. So reducing expenditures, for example, delay in recruitments, and a whole range of measures to try and bring the overspend down, and that's been largely successful. So the month 4 position is forecasting a £4.5 million underspend, which is much better than the 15 million in that report. So that's the first thing to note. This, like I say, this is out of date, this report, because of the timing of committee. So that's much more optimistic. In terms of where we expect to be at the year end, clearly, as Jonathan and I have already said, there's a huge amount of uncertainty at the moment for what we may be contending with. But we are expecting there to be some measures that government are introducing that will help. So, for example, just recently it's been announced that PPE for social care will be provided through a Department of Health portal, so that will reduce some of the impact of the department's overspend. So the adult social care market will have PPE free, and there's been a strong recommendation of the Adult Social Care Task Force that the infection control grant would continue, and that again will help with the support to the market in managing their COVID response. So we are expecting the financial position to recover somewhat by the end of the year, as well as our ability to use some of our over delivery of savings against the current year position, which will be helpful. So moving on to performance. Like I said, the COVID response has had an impact across our performance, as had the impact of COVID more generally on the population. So as a department, our main emphasis was about keeping in touch with people, both the social care market direct payment recipients, and making sure we kept our critical services such as the MASH and the district teams able to meet with people. So that's been the priority. We've now been standing up our work around housing with care and support, looking at the reviews that we need to undertake, but still we're having to have quite a focus on specific areas. So the two areas that you can imagine are most impacted by COVID is about day support and day opportunity day services, and the second is about the care market, which we've talked about quite a bit today. But so our focus for reviewing activity and making sure people are secure with their community support is going to focus on those that receive day services. So that's going to be our focus for the rest of this time. But there is going to be a risk to, to all of our performance, whether that's reviewing activity, our personalisation because of the COVID response, but we're doing our best to get in some recovery plans across the services to meet that. So like I say, what I intend to do is if there are specific questions, we have Sue and Ainsley on the call to answer those. But like I said, the next performance report we expect to be more meaningful, other than me telling you we've been responding to COVID.
Thank you, Mel. I've got Councillor Martin. David, please.
Yeah, morning. Well, since the last meeting, the overspend on the department's gone up from 12.9 million to 13.56. So I know the reasons for this are a lot of it's COVID related. But at the recent full council meeting, Councillor Cutts alluded to the fact that she was going to get the rest of this money back from the government. So what measures have been taken to try and get some of this money back? And actually, it's a bit difficult to deal with a report that's out of date when we're here to debate this report today. So I find that a bit, So what's the county council done, and what has the Adult Health and Social Care Department done in order to try and reduce the 12.9 million, which is now 13.56 million, as a result of the COVID pandemic? What have we done to get that money back from the government?
Thank you, David. Melanie.
So obviously timing is about the fact that we have a lead-in period to prepare committee papers, and that's something that committee has always lived with. There's a gap, which is why I'm able to provide a verbal update. But I do recognise, as I opened up with the report, that there is a timing issue because of the summer period. So I'm really sorry about that, but unfortunately that's just the timeline we're working to with the finance team. In terms of what I've done to get the money back, so we've made sure that we've used the infection control grant to its fullest, and that we've supported our providers in their ability to make claims against that. So we've been very active in making sure we use full use of that. As a county council, we provide Delta returns, which is our main way of corresponding with the government about our financial position, and the Director of Finance is responsible for completing that. So our main role as officers has been to make sure that's as accurate as possible, and that we're really clear about the evidence base for our COVID-related costs. And just to correct you, that all of our costs in adult social care and health, the overspend is related to COVID, not some of them or most of them. All of them are. And as a department, we've taken, like I said, a number of mitigating actions to bring that overspend down. So working particularly closely with health to make sure we can charge all eligible packages of care to the CCG, to make sure we're undertaking financial assessments through the period when financial assessment was suspended, and as soon as that period ended we could enact those assessments. In Ageing Well, making sure that we're reviewing packages and having people access reablement, because I think, as Councillor Doddy made the point earlier, we know that this period is impacting on people's health and well-being, so making sure they've got good access to reablement to regain their independence where that's been impacted. And in Living Well, where we have some pressures on placements arising because of the housing situation in the county, because I'm sure you're all aware there's a huge pressure on housing given all of the schemes through COVID that used up district and borough council housing allocation. We're making sure again that we're reviewing those packages of care, and we've got clear plans in place to support people to move on. So I think some of the key mitigating areas as a department.
Thank you, Mel. I've got Councillor Wise. Muriel, please.
Thank you, Melanie. Thanks for the report. And I know that you've referred to the fact that your the work on reconfiguring day services provision is an area you're moving on to. I just wondered if you wanted to say anything about this interim period when I suppose it partly comes under Living Well, partly under Dole's, about the situation of people who've not been accessing day services for the last 6 months or so. You know, what feedback staff officers have had from people who are mainly at home, and what sort of visits have been made to people where it's been needed, and have you had the resources to do that?
So if I may, I'll ask Ainsley to comment on how we reshaped the day service support staff to provide one-to-one support at home, and then to give some feedback really from some of the examples we've had of people who have found alternatives. If that's okay, if I can hand over to Ainsley.
Thank you. That'd be useful.
Good morning, Councillor Wise. I wouldn't say that people haven't accessed day services. They haven't accessed our day service buildings because obviously we weren't able to bring people together within our building-based services. However, everyone that would normally attend our day services have had an offer of some kind. Now, that has been different for different people depending on their circumstances and their own personal choices. So, you know, for a lot of people, we have provided one-to-one support at home, particularly those people who, you know, live at home with family carers and require things like personal care or assisted meal times. So, you know, we have been undertaking quite a lot of one-to-one visits. We've done quite a lot of sort of, you know, getting people out to exercise as we've been able to do that in line with the government guidance. So, you know, again, just giving family carers a break, getting the individual out of the house, you know, to exercise, burn off some of that energy, etc. And equally, we've done quite a lot of virtual things as well. We've tried really hard where people have particular friendship groups within the day centre. We've tried really hard to facilitate, you know, bringing those people together through virtual means, whether that's been, you know, Zoom quizzes or, you know, sort of we had a writing group where people were writing letters to one another, which is, you know, it's quite old school, but, you know, people enjoy doing that. So, you know, we have every week we've made contact with everyone to check in on them, to make sure that what they're receiving is okay, and that, you know, everyone's fine at home. But equally, there's lots of people who either, because of their fear of infection, haven't either wanted us to come into the home, or certainly now, as we're starting to introduce people back into our buildings, don't feel ready to come back in at this point. So at the moment, we're running almost like a dual service. We have started since early September to start bringing people back in, albeit on a limited basis, because obviously our capacity is seriously impacted by the social distancing measures that we have to put in place. But we are still continuing to support people at home as far as we can. You know, the staff team have had to be incredibly flexible. Not only have they been providing day support, but actually we did redeploy quite a large number of them into the reablement service, as well as residential services. So, you know, we're just now starting to bring back an element of normality, but it is still on a limited basis. But we do check with people very frequently, Councillor Wise, to make sure that you know, everyone's okay and that they're satisfied with what's going on. And some of this, we've had some fantastic examples of, where people have gone out to celebrate birthdays. Staff have turned up outside someone's house, singing and, decorated the front of the house with banners and balloons and all manner of things. They've been really creative about how they've supported people.
Oh, thank you very much for that update. That's really reassuring. Thank you.
Yeah, thank you.
Yeah,
thank you for
thank you.
It was really useful. I've got no more speakers, so we'll now move to the vote. Anyone against the motion? Anyone abstaining? So, Councillor Martin. You're on mute.
Yeah, I think, the actual written report paints a bleaker picture than the verbal report, and how can you ask me to vote on a report that's out of date?
That's fine, David.
Can we have the updated version in writing as soon as possible then, please? Because I'm not confident about that.
Yeah, that's fine. We'll arrange for that to go out. That's okay, Mel, is it, if it goes out when it's ready? Yeah, that's fine. So are you abstaining, Councillor Martin?
Yes, I am.
Yeah. Do you want to do the full vote then, Noel, please? I don't think you're coming through, Noel.
Come on, hear you, Noel.
Just bear with us for a moment. We've got technical issues at County Hall.
Smoothly done. Right. If we could have in turn people indicate whether they are for, against, or abstaining in the following order. Joyce Bosniak.
For.
Thank you. Dr. John Doddy.
For.
Thank you. Boyd Elliott.
For.
Thanks. Sybil Fielding.
For.
Thank you. Tony Harper. Thank you. David Martin.
Abstain.
Abstain. Thanks. Francis Purdue Horan.
For.
Thank you. Andy Sissons.
For.
Thank you. Steve Vickers.
For.
Thank you. Muriel Wise.
For.
Thank you. And Yvonne Woodhead.
For.
Thank you very much. So that is 10 for and 1 abstention, Chair. Thank you.
Thank you, Noel. We'll now move on to item 8 on the agenda, which is on pages 53 to 92 in your pack. It's Adult Social Care and Public Health Recovery Plan in response to the coronavirus pandemic. So this report provides committee with details of the adult social care and public health journey in the development of its recovery plan in response to the pandemic. Page 2 to 3 sets out how the department has responded to the corporate recovery principles that were put in place to guide and inform individual departmental plans. The engagement and approach to recovery is detailed in the roadmap diagram at paragraph 8, with further detailed feedback at appendix 2. One of the key outputs of the engagement and feedback was the development of recovery profiles that can be found in Appendix 1A. There are 5 key areas of focus that are being prioritised by the department to progress recovery, i.e. financial position, day services, carers, mental health and workforce. So as the department moves into recovery, specific areas have been identified as a priority. These include the sustainability of the social care market and reshaping of services, reablement and supporting people from hospital, resettling and rethinking health and care services, implementing our local outbreak control plan and infection control. The recommendations of the report are set out on page 61 of the agenda pack, and they are to approve the recovery plan and priorities for the Adult Social Care and Public Health Department following the implementation of emergency operating models in response to the coronavirus pandemic. So to debate it, I'll formally move the recommendation. Do I have a seconder, please?
Second that.
That's Councillor Boyd Elliott. Thank you. Grace Natoli, could you introduce the report, please?
Thank you, Chair. You've covered some of the points that I was going to mention anyway, but in addition to that, I think it's important to highlight that, you know, adult social care and health has remained open during the pandemic, although we've had to do things differently, as articulated by my colleagues earlier. We're particularly pleased that we didn't implement the Care Act easement legislation. As you've highlighted, a number of emergency operating models were put in place, and it would be fair to say that we had some really good systems in place where we had to implement differences of operating models very quickly. I'm informed that we are obviously still within the emergency phase, but certainly we have started to stand up some of those services that had stopped, or we had to do things differently, as articulated earlier, particularly by my colleague Ainsley. So, you know, like I said, you've covered most of the things. Some of the things that I wanted to, certainly one of the things that I wanted to cover was in relation to the workforce, one of the priorities as part of the recovery plan. I'm sure committee will agree that the workforce is our biggest asset, has been our biggest asset, especially during the pandemic, where the people have had to do things differently. And during this period, they have remained resilient and resolute. In paragraph 37, in particular, I just wanted to mention that as part of the recovery activity, we are tracking that through a recovery and transformation group, which I chair, and both Appendix 1 and 2 of the report are basically tracked and monitored through that group. That's all I wanted to mention, Chair, and myself and my director colleagues will be happy to take any questions that you may have. Thank you.
Thank you very much, Grace. That was really informative. I've got no one showing a hand, so if nobody's got anything to ask or any statements, then we'll take it to the vote. So anyone against the motion? Anyone abstaining? I'll therefore assume assent. Thank you. And we'll now move on to item 9 on the agenda, which is on pages 93 to 96 in your agenda pack. And it's the review of the staffing structure within adult social care. In November 2019, committee gave approval, subject to consultation with staff and recognised representatives, for a revised staffing structure. Following consultation, over 1,000 staff were enabled into posts in the new structure using the Council's agreed employment policies. Implementation had been due to commence from April 2020. In order to allow the department to focus on the emergency response to COVID-19, the implementation was postponed until the 1st of September 2020, but is now in place. The main changes and a list of those services outside the scope of the staffing review are described in paragraph 5 and 6. A review of the structure prior to the COVID-19 outbreak and lessons learned during the pandemic identified a need to enhance the level of management resource in the new Maximising Independence service. The disestablishment of some vacant posts and the establishment of an additional senior practitioner level post is therefore proposed in this report. This change can be managed from within the existing budget, and the recommendations of the report are set out on page 95 of your pack. They are as follows: that approval is given for the following changes with effect from the implementation of the new adult social care staffing structure on the 1st of September 2020. The disestablishment of 1.7 full-time equivalent vacant promoting independent work, which is a grade 3, from the maximising independent service structure, creating a saving of £26,477. B, the establishment of an additional 0.5 full-time equivalent senior practitioner, occupational therapy, advanced social work practitioner, which is band C, within the maximising independent service at a cost of £26,385. To debate this, I'll formally move the recommendations. Do I have a seconder, please?
Happy to second that.
Thank you. That's Councillor Boyd Elliott. Sue Batty, would you introduce the report, please?
Thank you. I've very little to add, really, just that I was really pleased that we have managed to implement the remodel after it was delayed due to COVID-19, and that we've managed to do it successfully with over 1,000 staff. So we did do a quick review as part of recovery planning, and I'm also pleased to say at this point these are the only changes that we'd make. We are intending to do a full review of the structure when it's been in place in 6 months, so that will be March. But we're also scrutinising every post as it goes to recruitment as well, just to make sure that it's the best way of doing things, that they absolutely need those posts at the moment. So that's all I have to add. I'm happy to take any questions.
Thank you, Sue. Any questions or comments, please? I've got no hands up, therefore we'll move to the vote.
Sorry,
Councillor Wise, Muriel.
Yeah. Sorry, I'm a bit slow. Yeah, no, just it isn't a question. It's just an observation, really. So I think the slight changes have been a very positive thing in the light of what's been learned through the period of COVID. So yeah, I'm very supportive of it. And I meant to say when Grace was speaking to actually acknowledge the value of her report and to acknowledge the fact that she's done this during a period of clampdown when she's probably not met anybody face to face. So I think it's been a really creative report in difficult circumstances.
Thank you.
Yeah.
Thank you, Muriel, and thank you again, Grace, for all of your work. It is appreciated. Thank you. And thank you for your comments, Muriel. So we'll now move to the vote. Anyone against the motion? Anyone abstaining? I'll therefore assume assent. Thank you. We'll now move on to item 10 on the agenda, which is on pages 97 to 110 in your agenda pack, and it is a new approach to providing direct payment support services and changes to the staffing establishment. So this report requests approval for commencement of a competitive exercise to establish a framework agreement of direct payment support services. This will be used across Nottinghamshire County and City Council, adult and social and children's departments and all Nottinghamshire Clinical Commissioning Groups, CCGs, with the County Council as the lead provider. The report also seeks approval for the creation of a new post within adult care financial services and the conversion of 2 temporary positions to permanent positions. The details of these are covered in paragraphs 5 to 33 of your report. The temporary post being made permanent will help the council recover money from DP accounts where there is a surplus and to manage accounts in accordance with the direct payment agreement more effectively on an ongoing basis. The finance assistant role will enable the council to offer a managed account service in-house, which will be more cost effective and will be financed by money that would be paid to an external provider if the post is not created. So the recommendations of the report are set out on pages 104 and 105 of your agenda pack. They are that the committee, 1, gives approval for a competitive tender exercise to establish a framework agreement of direct payment support services, which will be used by adult social care, children and families services, Nottingham City Council, Nottingham and Nottinghamshire Clinical Commissioning Groups and Bassett Law Clinical Commissioning Group. 2, gives approval for Nottinghamshire County Council to lead the tender exercise on behalf of the other parties. 3, receives a report on the outcome of the tender exercise. 4, gives approval for the establishment of a permanent 0.6 full-time equivalent finance assistant, managed budgets post, grade 4, to sit within adult care financial services. And 5, gives approval for 2 temporary posts that sit within adult care financial services to be made permanent as follows: 1 full-time equivalent finance assistant, grade 4, 0.5 full-time equivalent business support assistant, grade 3. So to debate it, I'll formally move the recommendations. Do I have a seconder, please? Thank you. That's Councillor Boyd Elliott. Sue Batty, would you introduce the report, please?
Thank you, Chair. So as councillors will be aware, direct payments are a really positive choice for many people because they offer more choice and control over their support. And that's particularly the case if people choose to employ their own staff as personal assistants. And that's a key priority for us at the moment, is to increase the amount of people who can have a personal assistant. However, with being an employer of your own staff also comes a number of responsibilities that some people need support with, and that's what the group of services we're talking about today are. They're known as collectively as direct payment support services. So there's a number of different ways across the countries that these have been delivered, and we've looked at those, and we've also consulted with people and staff to shape what the services should look like in the future and the best way of delivering them, and that's set out in this paper. It's a real positive that the contract is joint, has been jointly designed and will be jointly shared across health and social care across the city and county, because that some people have support, have a personal budget element from health and also social care. So it gives a joint approach and streamlines that for people. And the approach actually gives a really good range of variety of different options that can be tailored to meet different people's needs, hence the options that are recommended. I'm happy to take any questions.
Thank you, Sue. I've got Councillor Martin, David, please, and then Councillor Wise.
Yeah, morning, Sue. So my question is over really the choice and control. Will it remain with the service users? Because obviously some of them employ, if I'm right, in private individuals to do this task for them, and they don't always go through an accredited service provider, do they?
Yeah, the reason that we're shifting from accreditation to a contract is that for most of these services is that they really are our first line of contact if things might start to not be okay with the person. So we need a really good flow of information between us and the direct payment support services, and it enables us to, if people using the services have any problems with the services or unhappy with the quality, it means that we can support them through that. But of course, as with anything, there's always this will be the option that will suit most people. But you are quite right, some people do have individual people for very good reasons. For example, they might have a relative who wants to take this on, and so there's always the exceptions, and we can accommodate that where that's the best approach.
So that's still going to remain in place then?
It can. This will be the main option, but if there's a good reason about why somebody wants, we won't have accredited providers, but if there's a good reason why somebody wants, for example, a family member to offer this support, then that's not an issue. We can accommodate that.
Okay, yeah, thanks.
Thank you, Sue. Thank you, Councillor Martin. Councillor Muriel Wise, please. You're muted, Muriel.
I think you've answered my question. I think I didn't quite understand paragraph 44. I'm certainly. I think the the way forward is the right way, because choice isn't very valuable if you haven't got the knowledge to make the best choice for yourselves. But I didn't quite understand paragraph 44. I'm not sure if it's answered Dave's question. I didn't know what you meant by legacy arrangements will be needed to ensure continuity of service.
So there'll be a review for people. Yeah. So everybody. So obviously we don't know who will be on the new framework until we've completed the tender, and that may not be the same providers who are currently on our accredited list. So where people want to continue arrangements, if those providers are not on the list, then we'll review that and look at whether there's particular issues for them wanting to continue with those providers. Obviously, it would be ideal for most people to move over, but we'll work with the providers and the service users to make that transition and look at all the issues for them during that.
So those providers wouldn't have to come onto the accredited list. Would you check that they were still kind of giving a legitimate and quality service?
We will be transitioning, but we won't do it all at once, and we'll work with the providers and the service users to do a review and transition onto the contracted providers. Where there's particular circumstances where people are very unwilling to move, then we'll have to have a look at those and see what the way forward. But the intention is that they will all need to be with a provider who has a contract with the council, that will move to that over time.
Okay, thank you. No, because that's the reassurance, isn't it?
Yeah.
Yeah. Thank you.
Thank you, Muriel. Thank you, Sue. I've got no more hands up, so we'll move to the vote. Anyone against the motion? Anyone abstaining? I'll therefore assume assent. The motion is carried. Thank you. Move on to item 11 on the agenda, which is on pages 111 to 116 in your agenda pack, and it's the retender of the funeral services contract. So this report seeks approval to retender the current funeral service contract, which incidentally ends on the 31st of March 2021. It runs to March 2024 with a 2-year extension option. So under section 46 of the Public Health Control of Diseases Act 1984, the council has a statutory duty to arrange a funeral for any person who dies in care home accommodation in Nottinghamshire where that individual has not made any funeral arrangements, or there is no one willing or able to make funeral arrangements for them. The current service commenced on the 1st of November 2015 and is scheduled to end on the 31st of March 2021 next year, following a 6-month contract extension that was implemented in response to the COVID-19 pandemic. The recommendation of the report, as set out on page 114 of the agenda pack, is to approve the retender of the current funeral arrangements contract to commence on the 1st of April 2021 until the 31st of March 2024. A 2-year option to extend will also be incorporated into the agreed contract. So to debate it, I'll formally move the recommendation. Do I have a seconder, please? Councillor Boyd-Elliott, thank you. Corporate Director of Adult Social Care and Health, Melanie Brooks, could you introduce the report, please?
Just to add on to your very good summary, Councillor Harper, this is obviously a kind of a standalone duty, so that we're considering this issue in isolation, because it's a very specific duty. And given that the existing contract has been in for some time and we've extended, we wanted to go straight out to retender for good practice reasons. So that's all I just wanted to add, really.
Thank you, Mel. I've got nobody with a hand up. So if that's the case, we'll move to the vote. Anyone against the motion? Anyone abstaining? I'll therefore assume assent and the motion is carried. Thank you. We'll move on to item 12 on the agenda, which is on pages 117 to 122 in your agenda pack, and it's the market management position statement.
So the report provides committee with an update about work undertaken within the quality and market management team. The council has a legal duty to ensure that there is a sustainable social care market of social care support services available for people living across the county. The team undertakes annual quality audits, unannounced visits, support and development work with both community and residential care providers to ensure that people have access to safe, good quality care, whether that be in their own home or within a residential care home. The report gives information about examples of individual piece of work that the team have developed or been involved with during the COVID-19 pandemic. The report also contains the current position in respect of social care providers that have had their contracts with the council suspended. The recommendations of the report are set out on page 121 of your agenda pack, and they are: 1, that members consider whether there are any actions they require in relation to the issues contained within the report, or 2, members advise how the committee wishes to monitor the issues contained within the report. So to debate it, I'll formally move the recommendations, and I've already got Councillor Boyd-Elliott with his hand up. Thank you. I'll be seconding it. So Corporate Director of Adult Social Care and Health, Melanie Brooks, could you introduce this report, please?
Yep, thank you. So I do have Gemma Shelton from the Quality Market Management team ready to answer specific questions in the green papers when we move to the exempt part of the meeting. But just to really sort of highlight, I think some of the things that are particularly significant about the social care market. So I think we've probably mentioned quite a bit that we're supporting providers, and that's all providers. It's not just older adults care homes, which gets a lot of media attention. It's all of our providers, home care providers, supported living accommodation, day service providers, making sure they've had really good information, they understand when the guidelines have changed. And believe me, government guidance for providers has been changing ever so frequently. So keeping in touch with them to make sure they have that information in a timely way has been really important. And I think the team have done a very good job of that. At the members reference group recently, you heard quite a bit of detail about how we're working in partnership with health to tackle infection prevention control in care homes. So I'm not going to go into any detail about that unless somebody wants to answer that question. But we have mentioned that in there, as well as our ability to provide PPE. I mean, PPE is quite stable now. So you heard me earlier talk about how that's going to be provided through the portal. So we're now in a position of stability, which we weren't at the beginning of the pandemic, but that's very stable. I'll just touch on the NHS capacity tracker, because I think it's quite important that committee cited on that. The way that government gets assurance that we're spending the infection prevention control grant, sorry, I said that wrong, it's infection control grant on the social care market, that money is going straight from us to providers, is through this capacity tracker. And that is how they also monitor that we're making sure the market are sticking to the guidelines that the Department of Health has issued. So we have a tracker that the market is prepared, has to fill out every day. And then I have scrutiny, but direct from the minister, so direct from the department, or via ADAS regional branch, if there are questions that tracker is raising. So the tracker, for instance, will ask about people being tested on discharge from hospital for COVID. It will ask about staff isolating. It will comment about outbreaks. So that's the main vehicle for which that information is fed through. So I think it's quite important that you're cited on that. The other piece of work that I think was very significant that it touches on in the report with only a paragraph 13, but I really want to highlight this, is the work we did to make sure discharge from hospitals into care homes was safe. So we worked very hard on this, and we escalated at a very early point in the pandemic that it was a human rights issue and a safety issue to have some really tight controls around discharge into care homes. So what we have is a process that we developed jointly with the CCG that is like a checklist. So care homes have to pass through the checklist if they're taking people with COVID into the care homes, and that ensures safety. So there's a small number of care homes who are checklisted and deemed safe to do so by the infection control team and the CCG. So I think that's quite important to note. That was a really important piece of work, making sure care homes and care home residents were safe. We have been undertaking business as usual work, so believe it or not, the team has had time to follow up on normal quality concerns, if you like. It's fair to say that a big amount of our inquiries are either to do with visiting policies or to do with reports of care home staff or home care staff not wearing PPE. That was a big sort of form of concerns through the pandemic. So we respond to those, but we're also responding to our normal quality mechanisms. And the CQC is now standing back up inspection. It looks in a very different way to it did before, and it's going to focus on those providers which have got the biggest concerns, rather than a routine programme of work, but that's now stood back up. But yeah, so I think a lot of the detail will be in the green papers, and we can cover off specific queries about that when we move to that part of the meeting.
Thank you, Melanie. I've got two speakers, Councillor David Martin and Councillor Andy Sissons. So Councillor Martin, David, please.
Yeah, I'm glad you highlighted paragraph 13, Mel, because it was a particular problem during the pandemic, I think, with quite a few care homes falling foul of that system. The shift in the quality of some of the care homes is quite, what is it? Is it a robust process? I mean, we've got 73 here that require improvement. How many are teetering on the brink? I think we could do with a more detailed analysis of that across the county, really, where they're falling foul of the system and what action's actually being taken to make them improve their game. Because I can see we've still got 6 that are inadequate, and I'm sure that's in the exempt report. So I think we ought to have more detail about what the process is for making sure that the care homes that are in the require improvement zone, what action's actually taken to make them up their game.
Thank you, David. Mel, if you can just reply for what's in the public domain, please.
Yep, so paragraph 18 refers to the outcome of the CQC inspection. So that's clearly the statutory duties of the CQC to deliver. So we're reliant on the CQC to undertake their own duties. So if a home requires improvement or inadequate, there's a process that they have with the CQC, of which we're aware of and involved in, about a grid improvement plan. But that is very much the CQC's role. Our role about the quality comes in paragraph 20. Oh, excuse me. And in the green papers, we do highlight the process that we're in for each one of those suspended providers. So we do talk that through. And Gemma, who will be on the call, and I'm sure she'll be very happy to talk through an example in summary about how we do the operational process about working with a provider. But when it's our quality concern, it will involve having an improvement plan in place with that provider, regular checks on that, which might be at the moment it's less in person and more so over the phone, but will result face to face. And then we use a lot of data and intelligence for that. So we'll use CQC intelligence, information from carers, feedback from people residing there, as well as our own experience of the staff going out and getting a feel for the service and inspecting specific concerns.
Thank you, Mel. Do you want to bring anybody else in to answer this?
Not at this point. I think the next part will be where we can go into a bit more detail.
Yeah, thank you very much. Councillor Sissons, Andy, please.
Yes, thank you, Chairman. Let's try and take my hand down. I just wanted to ask Melanie about something she mentioned in an earlier agenda item. And obviously it was a quote from a national newspaper, so it is in the public domain. When Melanie said that the Times quoted that cases in care homes in Nottinghamshire were spiralling out of control. I wondered how much truth there was in that, please, Melanie.
Yep,
Thank you, Andy. Mel, I know that this is quite current and has been discussed, hasn't it? If you want to supply the information, please.
Yeah. So we have seen an increase in what in public health we describe as situations. So a situation is where there's been a positive test of somebody in a care home. And we would describe there's been an increase, but that we're very confident that it's well managed. So I think I described that we have the system of working across Public Health England, CCG, Infection Prevention Control Team, and with that provider to manage that. So we would describe this as well managed. However, I think as Jonathan has said quite clearly in his items, it is there's generally a concern about the increase in COVID, and as we see the R rate increase in Nottinghamshire, we will see people, either workforce or residents, most likely testing positive. But we wouldn't describe it as out of control. We describe this as well managed, but concerning.
Thank you. Andy, is that okay?
Yeah, thank you, Melanie. I just wanted really to give you the opportunity to answer that bit of press, because I didn't take it as word for word, and I'm quite confident that our team is managing the situation. But obviously, when there's something like that in the national press about it spiralling out of control, the public needs reassuring. Thank you.
Thank you. I was waiting for someone to bring it up. If not, I would have brought it up myself. So thank you, Andy, for raising that. Councillor Joyce Bosniak. Joyce, please.
Well, just on that same point, then, can we be clear what what currently our rating is, please? Because it does seem as though there's a bit of a time lag between what someone reports and what the current situation is. So, Melanie, do you know what our current rate is?
I would have to pass to Jonathan on that one in terms of the R rate.
Okay. Has he gone?
So
Jonathan,
I'm here. I can help on that one if you want, Chair. So
yes, please.
So there are two or three things, aren't there, that we've that come up in the last minute or two. First of all, there's the number of there's a report in yesterday's paper about outbreaks in care homes, which there's no detail behind it. We have the detail, and as Melanie's described already, we can tell you how many situations there are in care homes across Nottinghamshire that we're managing as outbreaks. In most cases, that's 2 in each care home. It's 2 cases, so we're not talking about something that's out of control. But there are, as of yesterday, there were 14 care homes across Nottinghamshire County where we had situations like that. And just to be clear, those are residents or staff members who've ended up testing positive as a result of the routine testing that takes place across all of our care homes. And Melanie's already described that's well managed. In terms of the rate across the whole of Nottinghamshire County, the outbreak cell is meeting at the moment as we speak, but as of yesterday, the rate across the county as a whole stood at 28.5 per 100,000. But as with these statistics, that masks a certain amount of variation within the county. And in a borough like Broxtowe, it's higher than that. It's up in the 40s. And at the moment, in Gedling and in Bassetlaw as well, I think it's lower. But right across Nottinghamshire County, the incidence rate is rising at the moment. They're higher this week than they were last week, and some of those rates are going up quite steeply. So this isn't a problem that I would I wouldn't pin this on care home setting in particular. This is a general problem about incidence rates right across our community rising. They're rising in all sorts of age groups, although, as we know from national data, they've been rising particularly amongst people of working age and amongst those younger working age, 18 to 35 in particular. In terms of the R rate, there's no time lag in that. It's just that it is estimated on a weekly basis. It's not something that we've focused on very much in recent months when numbers have been relatively small. Yeah. But now they're on the rise again. We did comment on this last week, and the estimate for Nottinghamshire is that it currently stands between 1.1 and 1.8. Yeah. Now, there's a couple of things to mention about that. Even at the lower end, it's above 1, so that's a matter of some concern to us. The second thing to say is that actually that's a really big range. 1.1 to 1.8 indicates a high degree of uncertainty about exactly where it does lie. and you'll find that the national estimates that are produced have a much tighter confidence range around them. But at the moment, that's what we're saying for Nottinghamshire. The top end of it is driven partly by the increase in the number of confirmed cases that we're seeing, and also last week we were starting to see an increase in NHS 111 calls, that some of which may have been related to either COVID or concerns about COVID-like symptoms. So there's a high degree of uncertainty there, but either way, that's a cause of concern to us because it means that increasingly coronavirus is circulating in our communities.
Thank you.
Thank you, Jonathan. There are no more speakers, so we'll...
Chairman, Mr. Chairman.
Yeah, who's that?
Francis Purdy.
Francis, hello. Yeah, go ahead.
While we're on this, can I ask a question, if I may? Perhaps Jonathan might be able to answer it. Whilst we're obviously concerned that there seems to be an uptick continuing over the last couple of weeks or more, what is the general situation with regard to hospitalisation or even deaths? Is there a context in that?
Thank you. That's a good question. So the situation as of last week was that in terms of hospitalisations, the increase in cases wasn't being reflected at all in terms of people turning up at hospital or being on ITU. In fact, last week, NUH had reported that, I think for the first time since March or April, they didn't have anyone on ITU with COVID-related complications. Now that situation may, even by this week, may be changing, but that was the situation then, and that reflects the point that I drew out, which is that the majority of these cases that we're seeing at the moment are amongst people of working age and in 18s to 35s in particular, and happily, for the most part, those that demographic are healthy and fit and not as vulnerable to complications from coronavirus as older people. And one of the things that we've been urging through our work with the media is that people who do regard themselves as healthy and perhaps not particularly vulnerable themselves are nevertheless mindful that there may be someone very close to them who is much more vulnerable to them. And therefore really asking people to bear in mind that all of us need to follow all of the guidance, including the rule of 6, which has just comes in today, because in that way we're protecting not only ourselves and those really close to us, but people who we may not know, but who will be depending on us to adhere to the guidance. And I'm thinking now in particular people in care homes and older residents. Whilst the cases sit within a younger demographic, that's not so serious in terms of hospitalisations. But if that spreads up through the age groups, that will become much more concerning to us.
Thank you, Jonathan. I'm conscious that we're moving slightly off the agenda item, actually, so I'll bring it back to the agenda item. I've got no more questions or comments, so we'll move to the vote. Anyone against the motion? Anyone abstaining? I'll therefore assume assent and the motion is carried. Thank you. Item 13 on the agenda is the work programme on pages 123 and 126 in your agenda pack. The recommendation of the reports are set out on page 124 of the agenda pack, and that's the committee considers whether any amendments or any requirement for work under the programme. So I formally move the recommendation. Do I have a seconder, please? Francis, thank you. Councillor Purdue-Horan. As I always say at this point, this is your opportunity to put subjects forward that you might wish to discuss at a future meeting. Noel, are there any changes to the work programme arising from the discussions today, please?
no changes necessarily. The two actions identified to date were that the Director of Public Health would circulate the gov.uk guidance to schools on how to deal with children who are unwell, and also that an updated performance and finance report would be circulated to committee members as soon as is practicable. Thank you.
Thank you, Noel. So we'll move it to the vote as there aren't any hands up. So anyone against? Any abstentions? Therefore, the motion is passed. Thank you. So we now move on to item 14 on the agenda, which is exclusion of the public. So we now move to that part of the agenda that proposes that we meet in a closed session to consider the exempt information in relation to agenda item 15. I therefore invite the committee to resolve that the public be excluded for the remainder of the meeting on the grounds that the discussions are likely to involve disclosure of exempt information described in Schedule 12A of the Local Government Act 1972, and the public interest in maintaining the exemption outweighs the public interest in disclosing the information. Anyone against? Any abstentions? The motion is carried. This therefore is the point at which we'll end the live stream. So may I take the opportunity to thank any viewers for their interest in the meeting and to wish you all well. Could you please end the broadcast?